Cancer is a global disease. 1 in 2 people in the UK will receive a cancer diagnosis within their lifetime, and healthcare services need to be ready to deliver this care in an optimised and efficient manner.
My name is Olena Martsenius, and I'm a radiation oncologist from Ukraine. Cancer have no border, medicine have no border.
So it doesn't make sense for any of us in any countries to be working in isolation.
Cancer care in Ukraine faces many challenges. Part of our medical and energy infrastructure was destroyed. We have everyday air raids.
The Christie and the UNCI, which is the National Cancer Institute of Ukraine, established a partnership in 2025 which is looking to expand capacity to deliver cancer care services in Ukraine and the UK. The motivation for this project is really focused around the mutual benefit that we can gain. Obviously, the NHS itself is not in a conflict zone, but there is much we can take from learnings around how to operate and how to deliver services in a low resource and stretched setting.
To treat cancer patients under very high pressure with limited resources and stressful conditions, we can treat Ukrainian cancer patients by NHS protocols and collect more and more data, which will be beneficial for both sides, for choose the perfect treatment in every single case.
As is clear from the NHS 10-year plan, there is a real focus around digitalisation and also around moving care from hospital to the community. And we believe that lessons learned through this project will really enable us to enact changes in both of these key areas, which will ultimately benefit the 60,000 patients we see a year at the Christie.
We couldn't bring every Ukrainian doctor to Christie, unfortunately, but when our doctors return from the Christie observership, they will train many of Ukrainian doctors to provide the best oncological and radiotherapy practice to a Ukrainian cancer patient.
International aid is a relatively small investment, but it's one that can bring massive impact to our healthcare services.
If this project will stop, it will have profound impact in cancer care in Ukraine.
We really would lose major progress that's already been made. UK patients and Ukrainian patients would suffer from a lack of this mutual knowledge exchange, and also the network that we've started to grow could potentially falter and we would have to start from scratch. Investing in global health isn't just the right thing to do, it's the smart thing for Britain. Because when we protect the world's health, it makes all of us stronger, safer, and more resilient.